I wanted to bring some information about the methods used for the assessment of beverage intake and fluid intake in general, drinking water and beverage consumption in the European Union, beverage preferences, the example of Austria, so water consumption in different European countries, and some data on influencing factors on beverage and water consumption, gender, age, type of diet, level of education, fruit and vegetable consumption, and also physical activity. The methods used for the assessment of fluid intake or water intake are not as accurate as you have in chemical laboratory. They are part of the epidemiological methods used in nutritional surveys. By the way, in the old nutrition surveys, fluids and water have not been considered. It is only in the past 15, 20 years we have a focus on water and fluids. So in the data, in the papers where I derived some information for you, so there is here, like what we have done in Austria, we use the questionnaire, we use a food frequency questionnaires to look at the habits of consumption, and use a drinking protocol, so self-reported protocol. So people say, so I drank water, how much of it? In Spain, they did also extended studies on fluid intake, beverage intake, using the same methodology and 24-hour records. In Germany, there's a very active group, have been cited yesterday, so Manz and others in Dortmund, and they used dietary record and also weight record. But in this part of the study, Manz and his group, so they looked at the water balance, and they used the dietary records and weight only for a subsample. The same group, they used 3 days weight record, dietary records, and they collected 24-hour urine from a subsample for looking at the fluid balance. And they, in another part of the study in Dortmund, they tried to find out whether the home carbonated water would have any influence on the drinking pattern. And lastly is this study, so published by Suzanne and Madam Gibson, and they looked at total water intake from solid and liquid foods. It was part of the National Diet and Nutrition Survey in adults. Weight record were done over 24 hours and in 24 hours and over 7 days. In general, those are the commonly used methods for the assessment of fluid intake and beverages. So some results will start with the fruit and vegetable consumption in adults in the European Union and the 25 countries divided in regions. So north, central, west, and south. And you see here fruit and vegetable consumption in the northern countries of Europe, the European Union, is lower than in the central of Europe. This is important because we will see a relationship of this to fluid intake, water and beverage intake. But in this region in the north. This is data published by EFSA. We have been 15 countries working on this project. And in the data from 2008, in the north, Denmark, Sweden, Finland, they consumed less fruits and vegetables, but they had the highest water, tap water, drinking water consumption, as you see here. So Finland, Denmark, compared to the other regions, so western of the European Union or Central Europe. The exception is Austria here. But it is an important result for us. Was it surprising to see that tap water is preferred in the northern countries at that level? 3 years later, EFSA used another method of the assessment of the total beverage consumption in the same regions here. And we have been also 15 countries involved. You see here the total beverage consumption in the north is not much different than in the Central Europe or in the West. But if you look at the blue lines here, this is the tap water. It is comparable to the other countries, but still somehow higher than in the West. In Central Europe, so Czech Republic and also Germany, they have relatively high consumption of water. But in total, beverage is highest in Central Europe, highest in Germany, followed by Czech Republic, and very small, as you see here, in Hungary, and in Poland is in the middle. Within a region, as you see here, so in the north, you see some countries have a total beverage consumption nearly 3 times as in other countries, as in Estonia, for example, Lithuania too. What happened now? I don't know. Yeah, okay, I don't know. Perhaps I jumped over one of these. But the preference, we looked at the preference for beverage in Austria, and you see here for the top 7 beverage is no alcoholic drink, no beer, no wine. So you have tap water, tea, coffee, fruit juices, milk, mineral water, carbonated mineral water. And in women, so top water is the first place. Tea is second, coffee third, and mineral water and carbonated water, so 5th and 6th position. In men, the first preference was given to coffee, then tap water, tea, and beer, as we have not expected. It is, as you see here, in women, the 10th position. In men, it is the 5th position. It is not on the top. The frequency of water, tap water and mineral water consumption in the Austrian population is given here. The frequency is how often people drink water of any type of these given. You see here, so in 2 to 3 times or 4 times a day. In younger people is higher than in the older adults, the elderly, so less, 2/3 of the frequency of drinking water. But if they have 2 to 3 times a day, so the difference is not so big. In Sweden, there was also a study in adults in Sweden looking at tap water as such, consumption. And you see here, so people drinking less than 1 liter or more than 1 liter. In men drinking less than 1 liter, more, the higher percentage than in women. If they drink more than 1 liter, it is a little bit different, so the other way around. And in general, it is between 35 and 50%, depending on the age group, people who consume more than 1 liter tap water per day in Sweden, in the adult Sweden. Carbonated drink consumption. In Austria, there is no high preference for this, as you see here. So some people almost never drinking. So in the elderly, so only 53% say never. And in younger people, so nearly half of this percentage. So that means so younger people drink more carbonated or consume more carbonated drinks. Per day, the consumption is not so high compared to other drinks, as you will see. Tea, the frequency of tea consumption in adults in Austria, as you see here, so once a day or 2 to 3 cups a day taken together. It is in the younger people here, in the younger adults, less frequency than in the older adults taken together. But so we don't have heavy tea drinkers so in Austria. You might have these people so in the north of Germany, so, but not in the south and not in the Alpine region. Lemonade, so another category, so the frequency of drinking is very little, so no high preference for this. But it is a bit better in the younger adults than in the elderly people. Very interesting is the information we got about the total consumption of non-alcoholic beverage in women and men, as you see here. So women consume more water and more total non-alcoholic beverage than men. And this is a very good result. So I think in line with the preference, as I showed you before, that the women have a higher preference, the first preference for water, tea. So for non-alcoholic beverage, in total, the women consume more than men. The slide is showing the total consumption of beverage in relation to the type of the diet. So vegetarians compared to omnivores. So we have in vegetarians, like in the case of women, so more people consuming water and total beverage than in the omnivores. So this is a very interesting result. So as you see here, so vegetarians, so they consume total volume of water and fluids in general, beverage, more than in the omnivores. And even the people with health conscious lifestyle, so less meat and meat products, and more fruits and vegetables, plant-based diet, they are better than the traditional diet consuming people in Australia. But this is a very interesting result. So because we are advising people to go for more fruits and vegetables, more plant foods, and to reduce the intake and consumption of foods of animal origin. This is a very good result for this. The availability of beverage at household level. this was derived from the household budget survey we did in Austria, but we have been part of the DEFNE project, which is an EU-funded project with more than 16 countries until now. And we see here, in relation to the level of education, so people with higher education, academic degree, so they consume less non-alcoholic beverages, but they have more of fruit and vegetable juices, but less of alcoholic drinks. This is very interesting result in relation of the total consumption of food and beverage in the population in relation to the education level of the household head, the one person who is earning money for the household. Physical activity in the two slides here showing that with higher physical activity, the total consumption of beverage and fluids is increased, as we have discussed yesterday and heard also from Ron. It was expected, but this is here confirmed. So with higher physical activity, the consumption of beverage and water is increased. That was in Austria, and here is another study from Spain. They're showing in a very good design study that water consumption, the frequency of consumption and the amount consumed depends on physical activity, as you see here. So the frequency, so in percentage of the respondents, and the total amount, the volume, increased significantly. Oh, that's too big. The consumption of fruits and vegetables in relation to tap water was studied here in the Austrian population. Can we make it a little bit so back? I guess. Yeah, that's good. So people, when they consume enough fruits and vegetables, they tend to consume less beverage. We have here, so the men and women all together. So when they consume low consumption of fruit and low consumption of fruit and vegetables, they have relatively higher preference and consumption of beverage. This is seen very good here, but if they consume a lot of fruits and vegetables, this means that they are perhaps more health conscious and they consume also more, in general, more beverage, more fluids. The adequacy, we looked at the adequacy of fluid intake in general according to fruit and vegetable consumption. In the population you see here, so with low consumption of fruits and vegetables, we had small amount of markedly low consumption of fluids, but the adequacy was given for 70% of the studied population. If the consumption is high of fruits and vegetables, the adequacy increased. That means fruits and vegetables brought additional amount of fluids. In one part of the studies from Dortmund, from Germany, it was well documented here with increasing fruit and vegetable consumption, the total fluid intake increased in parallel. As you see here, that was the first quartile, and here's together the second and third quartile and the fourth quartile. water intake from beverage and food in general. So in Austrian children, 6 to 14 years, it is very interesting to show that markedly low consumption of water from beverage with increasing age. Younger children obey the parents and drink perhaps more often than older children. So the level of adequacy, as you see here, is decreasing, so with the age. The consumption, beverage consumption in German children and adolescents 2 to 18 years, it was also done by the group in Dortmund. Dortmund was hosting the Institute of Research on Children Nutrition or Child Nutrition, a very active group. So they looked at the influence of home carbonated water. And if they stratified for this carbonated water, it was the users vis-a-vis this group, so non-users, that has influence on the total drinking fluid in general, so tap water, bottled water, but had no influence on soft drinks consumption and the total water intake in boys, and also in girls the same. So, but this is a special result. So, because carbonated water at home, it is not very popular. In Germany, they started to produce this at home, and they wanted to see whether this would influence the drinking pattern of the children. In the United Kingdom here, that was from the study by Gibson and Sheriffs, it was seen that hot drinks, hot beverage and milk was drank in the morning hours, and the alcoholic drinks in the evening hours, in men and women as well. And the consumption of alcoholic drinks, Susan can comment on this, varied over the week with higher intake in the weekend, as we see here, so Friday, Saturday, and also Sunday, higher consumption of alcoholic drinks than during the week. Age-related changes in water balance in Germany, it is given here. So with increasing age, as you see here, so the total water intake decreases, and the urine volume increases. That was the reason why I always tried to bring the age in the discussion, so we cannot compare the young adults with the elderly people, so over 60, 70, and 80 years. The water intake from beverage and foods in general, so in the Austrian population in relation to age, as you see here, the markedly low intake of fluids, water and other beverage, is the percentage of this group is increasing with increasing age. In the elderly over 60, we find more people, so around 20% not having the recommended amount of fluids compared to the younger adults. And this is in men, and more clear is the picture in the case of women. To summarize this part, low water intake I found from the different studies we quoted in the elderly. Lower intake of water has been observed in older adults. At the same time, the capacity of the kidney to concentrate urine decreases with the age. This is compensated by lower non-urinary losses, especially in men, less in women. And the high temperature, at high temperature, elderly people may be at risk for dehydration. And in summary of the whole presentation, water intake, water fluid intake, beverage intake, so varies widely across populations and regions in the European Union. Drinking water, so it is tap water, mineral water, bottled water is also counted to this group, generally contributes the largest part of the total fluid intake. The elderly and children are the two groups who do not reach the recommended levels of intake recommended by the according nutrition societies. Generally, individuals with a healthier lifestyle, I showed you the vegetarians compared to the omnivores, or the conscious, health-conscious people compared to the traditional diet, indicated by high fruit and vegetable consumption and physical activity level are better hydrated. So, and this is my last slide for you, and thank you for your attention.
So, thank you, Ibrahim. And we go forward with the discussion. Maria, you start first.
Yes. I would like to have from you a general comment to this question. Are you happy with this data? Do you think that this covers the need of having European database for water intake? I see data from various countries collected in different studies, sometimes with different methodology. Yeah. Some work on measuring tap water or mineral water, total water, fruit and vegetables, but we do not have good data that cover European population. Is this what you think, or you have a different opinion?
Yes, I am satisfied with this, especially since EFSA is trying to develop a generally accepted method in the assessment of fluid and beverage intake. So the different, in different countries, can I go back to the first? In the different countries, at the beginning I showed you the methods. You commented this very clear. Looking at data coming from these studies, we expect not a high level of satisfaction with the data. But EFSA tried to, in the year 2007, 2008, we have been a group of 9 countries at the beginning to have a concise method, and they looked at different drinks singularly, and they made, they made this comment. So tap water is preferred and consumed in much regions, in some regions and some countries of Europe, higher than in others. But they changed the method, so using a comprehensive method, looking at the whole spectrum of beverage, so water and other drinks. And I think if we can work on this, at least we will have comparable data between the regions and between the countries, and that is what we aim at. So we will have not the precision of the biochemical methods, or so in the laboratory. We have no biomarkers, so for fluid intake rather than osmolarity, but in population studies is not done. It is always done in this way.
Could you further comment on these methodologies? As you say, it is in this diverse group,
Yeah.
Sometimes it's important to see the benefits of using.
Yeah, but how, I cannot do it any better than using weight records, as they did here in the UK or in Germany, in Dortmund. This is, in epidemiological studies, I think a high level of precision. So it cannot be done any better, except measuring osmolarity and looking at hematocrit or blood volume. So, but I think in population studies, if we manage to use this procedure, so it could be, I think, good enough.
Because I guess this is the only way to achieve a better sample size.
Yeah. So, but if we look at this in many studies, published studies, they use food frequency questionnaires. So just looking at the habits. And from this, you can even develop a semi-quantitative evaluation, but it is not good enough. And even from the 24-hour recall, so you will have only one day of the week. You have to look at weekday or weekend day and repeat it. And nevertheless, it will be not precise enough. But if
you have 6,500 people, then
yeah. So this is the problem. This is the problem. So.
Another question that I had for you was about the messages that you can get out of these kind of studies. Is the message that people are adequately reaching their water sources?
No, I showed you that it is in some population groups.
It's not.
Is not. The adequacy is not given. So the elderly people, so over 65 and 70, so also in some younger age groups, it is not given.
So if we link water intake with chronic disease or acute disease, you need clear messages to the public.
Yeah, from
this
this
is
group of
what
experts.
You were saying before. And myself as a nutritionist as well, I share your passion for getting clear messages to the people. And I don't know if you can draw similar approaches from other cases in nutrition, let's say fat intake, for example, or energy. Can you draw analogies in how you deal in the nutrition field with this advice when you formulate nutrition messages?
Yeah, but it begins with the methods of assessment. If I use a not very strong basis like this, my analysis and evaluation for the food intake and nutrient intake, so fat and protein, is also weak. So I think it depends on the design of the method and how of the study and which method is used. But with the weight records, also in assessing the food and nutrient intake from this, if I go for weight records, this is the best recommended method to be used. And if I apply this also here, I think I can rely on the results I get for total beverage intake, total fluid intake, and for total food intake, and calculating with the proper database, food composition database from the food intake, the nutrient intake, fat and protein, and even micronutrients. It depends, again, on the design and the method I use, and how is the effort which I would like to put in a study. In large-scale studies with thousands of people at population level is not always easy to do this. I just finished a study in Palestine with UNICEF on the nutritional status there. And we had in total 7,000 in the West Bank and in Gaza. And it was not easy to have a 24-hour recall because they don't have a food composition database and they don't have the tools to calculate from the 24-hour recall the food intake. So therefore we said we take the food frequency questionnaire to look at the habits, but we rely more and much more on the laboratory assessment, the results of the laboratory assessment of the micronutrient status. Not the intake of folic acid, but how is the folic acid status, and vitamin B12 and zinc and so on. And this is, I think, something the leader, manager of a study should decide to go for. What is doable, with which precision.
I guess it's important to have both, because with the
course,
marker, you just reflect on the reality with the record.
No, again, from
understand the habit. And
again,
the
from my own experience, the Austrian nutrition report is done every 4 years, and we had the last one published in 2012. We had a national representative survey, and we looked at the intake as well as the biomarkers. And we are very lucky with this. I think we are the only country in the European Union who did it for the whole population, National Nutrition Survey. In the UK, they are also for segments of the population, so good studies, but not for the whole population. In Germany, nothing of this is perhaps only for the adolescents. And in other countries, it was not possible, but our Ministry of Health wanted to invest in this, and we did it both from the epidemiological side, the best methods we could apply, so FFQ and 24-hour recall, and for children we measured data, and self-reported data were not used in the last report. And from each nutrient we had at least 2 markers, biomarkers, so marker of supply and marker of function. And this is, I cannot do it in other countries. So rich countries like Germany said it is expensive. In Switzerland it's impossible. And I went to Palestine and to UNICEF. I said that we cannot pay for that. But they paid at least for the laboratory program, and that is, I think, the choice we can do. Yeah.
So how many people were you testing in Austria?
And we had the statisticians so calculated the sample size, so to 1,100. But we have a small population. We have only 8 million in Austria. And this is statistically valid and good, but it covers the whole population, all regions. And, yeah.
Okay, may I continue with 2 questions before we open to
Yeah.
everybody? In dietary surveys, I think misreporting is a common problem, and some people forget or underreport water or all other food they take. Others overreport, probably because of social expectation.
Yeah.
What do you think regarding all these data? At the end, of course, it won't change the mean, but is it a big problem, or?
It is. It is a big problem with self-reported data, always. Self-reported data is not reliable. But if we, in many studies, we have 24-hour recall, so repeated recall, and we calculate from this the food intake, fluid intake, and further calculation of nutrient intake. But we have not, we started with this, it is now well accepted basis to look at the energy intake reported in the food record. And if it is less than the basal metabolic rate, at least so should be 1.12 basal metabolic rate. If it is not reaching that level, we delete the whole protocol. We say, so this is underreporting, and it is underreporting not only of energy, but it's underreporting so in everything. So we ignore this protocol in total. And if we're lucky and have a laboratory assessment program, so we take the laboratory assessment, but never related it to intake. The overconsumption is sometimes very curious. So we had some young people, especially, so making jokes with us, reporting 15,000 kilocalories, or something unbelievable. So we should ignore this, but it is a problem. It is a problem with self-reported data, and perhaps another problem so is known to many of you, looking at body weight and body height, and calculate from this body mass index, and self-reported data and measured data. You find from 5 to 20% divergence. So self-reported data, so people who are fat tend to give lower body weight, and the older people so don't like so to consider that with age of 70 they don't have the height of the age of 17. So self-reported data is very complicated in biological sense and also in the epidemiological studies. Therefore, so we recommend to have measured data, like we have it here in some of these studies.
Okay, and then one final question, going back to your summary. You say that for individuals with a healthy lifestyle and so on, consumption and physical activity level, they are better hydrated. And this leads me to a discussion which is always done in this context. Does intake really reflect hydration status? What do you think could be done in these studies to optimize regarding hydration status? We have the physiology, it works for most people, but
no, it is.
Is it really what the people need?
It is my association, or our association from these data. We wanted, the wording is important. So we wanted to say they reach the recommended level of intake.
Regarding EFSA or the national recommendations of the societies.
So if it is the German Nutrition Society or IOM, they reach or do not reach the recommended level. And the association is if they have reached this, it is adequate, they are hydrated. But we have not looked at this from physiological point of view.
Or comment first. Wait, Ron, microphone please. Or you have one still.
Friedrich Manz's group related the fruit and vegetable intake to the free water reserve. In the study from Austria, it was related to intake. Yeah. But in the German study, it was related to a marker of hydration. So I was going to question that, but of course in German they did so.
They did it. Yeah.
And it's quite reassuring that your data on intake correlated a very similar way to the German data where it was related to status.
And the Germans look at the balance, the water balance, and I think it correlated very good with each other. I think Larry was.
Okay, I was very impressed with this data on vegetarians because I was looking for data how much really water take vegetarians. This was fluid intake or total water intake, what you presented on the slide.
It is total
water
intake from
in solid foods
from all sources.
Okay, from all sources. Yeah. It is extremely important to our discussion because the vegetarians tend to have less metabolic syndrome than the other population, part of the population, and they are better hydrated. So maybe there's a link here. Well, that's exactly the point. Traditional Austrian take something like 1 liter of water per day less. This is what we discuss here. Yeah. And this would be a very important input into our discussion.
From all sources, so fruits and vegetables.
Are you aware of similar studies? Because I was looking for this data. This is the unique slide I could find.
I think this, in this way, so not very many. Yeah. Yeah.
Okay, Larry. Yeah, do some exercise, Richard. That's good.
As a physiologist, I'm always confused about the data with respect to elderly, because survey data typically shows, as your data do, that there are differences. And yet, careful 7-day dietary records show no difference in water turnover in older and younger subjects. The limited number of labeled water studies show no difference between healthy, community-dwelling elderly subjects and younger. And even more impressively, diet-controlled metabolic chamber studies in which they measure every single drop of water in and out show no difference between elderly and young, yet all dietary survey data, large population data do. So is the difference perhaps just the larger larger prevalence of disease and other problems in these large surveys, or am I missing something?
No, I think it is the balance again. So the urinary excretion is increased in the elderly people.
In well-controlled studies where you put older and younger healthy subjects in dietary wards, ad libitum water consumption, total water intake, water output through urine, total water output, and net water balance aren't different.
Yeah, but this is the controlled conditions of a study.
No, they give them the diet, they repeat the diet they normally eat, and so on. So.
Yeah, but I think so the population, so we are looking at here, so if we study the whole population, so we consider them apparently healthy. And even so, type 2 diabetes, if it is available, so it is not looked at especially.
So I think the answer, or one thing to consider, is that when we look at these surveys, we're not looking at primary aging.
Yeah.
We're looking at comorbidities in an older population.
Yeah. I think this is the problem of the epidemiology in general. So if we have apparently healthy people, it is self-reported, it is not objectively decided, and we might have some people with kidney function disturbance and something among them, but this is the fate of these studies. So Maria,
If I can add a comment.
no, you have. She has.
Have your microphone.
She has. She has.
I understand that you're describing a situation where you put elderly people in a rather controlled environment.
Not all of them, no.
Because
that's just one approach, but there are numbers of others where we and others inject deuterium into elderly and let them go about their normal business. Those all show in very healthy 80-year-old subjects no difference in water turnover compared to younger subjects. It's only survey data that shows the difference.
sometimes in survey data, although you have the possibility of reflecting mistakes because of misreporting, you have the advantage of having a relatively undisturbed situation. So sometimes people are more free to report what they actually do because they have nobody asking them too many questions. They are not embarrassed to answer differently. So sometimes in this kind of methodology, you have more chances of getting a reflection of the barriers. For example, we applied food frequency methodology in elderly people, and we saw that we find less water intake in the ages from 65 to 80 And one explanation is that these people are conscious for inability to keep,
Larry, this is the study. I think you quoted this group yesterday, so in your presentation, months. And they conducted a fluid balance, water balance, and they showed this very clearly. The total intake, water intake, is decreasing, and the urine volume is increasing, and it is not an assumption. So they did that. So in I think 400 people or 440 people.
I'm not suggesting it's an error or a mistake or sloppy data. I'm just suggesting that
it's not confirmed by physiology.
Than the behavior.
Yeah.
Yeah, but it is important to try to understand whether there are barriers in this age group for water intake.
Very much agree.
But I remember, so from the physiology, so we taught our students, and I learned it in the past, the kidney can concentrate the urine to have an osmolarity, so 6-7 times as in plasma. And this can be done in young people, as we had in the past discussion, so long period of time not seeking the restroom. So the mixture time is too long. Compared to 70 years old people, their kidney is not working normally. They are not diseased, so objectively. Their kidney so cannot concentrate the urine in the same way. I think I have learned this, and it is in our physiology book.
But is it not the case that total solute load is less in the elderly? Protein intake is less, energy intake is less, so there's less solute to be excreted?
The total energy intake is less in the elderly, but protein is not necessarily. It's not necessarily. It is nearly at the same level as in younger people, and they consume. We in our study in Austria, and I think in different countries, they found the same. The elderly have the highest salt consumption in our population, and I think that could add also to the negative balance.
For some time, myself, Ron and Susan have been interested in high habitual caffeine users, so individuals regularly consuming large amounts of tea and coffee. And particularly we were interested in caffeine withdrawal. And we tried to do some of those studies in Loughborough, where there's a predominantly student population. And we really struggled to find sufficient numbers of participants who consumed 4 or more caffeine-containing beverages a day. And a recent study from the UK supports that idea that caffeine intake accelerates from 19 years onwards. When you start to work, more coffee breaks, etc. And in younger people, we see generally less caffeine intake. Do you see those same patterns? Has that been looked at in your data? Do you see those same patterns across other countries?
We were interested in this point, and I think 2 years ago, we have not published the data yet. We looked at the coffee consumption and the urine volume. And it was using our type of preparing coffee, so percolating, so filter coffee, or not espresso, but the bigger cups, so 125 ml. Consumption of 2 cups had no influence on the urinary volume, but 2 to 3, even 2 to 4. So more than 4 cups, and the volunteers so worked with us, the compliance was given, increased significantly the urine volume.
Well, I think that's established that there's a threshold by which
we say
starts to become
we say so with
diuretic.
this type of preparing coffee, 2 to 4 cups, no problem. But with higher consumption level, it could be with negative influence on the water household.
But in terms of the pattern of change of consumption across the lifespan, do you see that same pattern of change in most countries?
No, we had young people, students who
have got high caffeine intakes as well?
Yeah. No. We took them, we compared non-coffee drinker with coffee drinker, or we started with non-coffee drinker and we gave them this amount of coffee. But it is still an open question, and caffeine has a diuretic effect. But it should not be at that level of causing a negative fluid balance.
Jose?
Jose.
I wanted to ask you about the percentage of water from food and from beverages. Mostly it seems to be reported that on average about 80% of water in the diet comes from beverages, including water, and 20% from food. But obviously that's average data, and you must see a big range across the spectrum. From the studies that you've talked about, is there anything to learn about the percentage of water that comes from food, and does that relate in any of the studies to total water intake? Do you perhaps see people who have very high, maybe fruit and vegetable intake, which is high in water, correlating with total water intake in any way?
From the mixed diet with the least amount recommended of fruits and vegetables, 2/3 of the fluid intake comes from preformed form, so water or teas, different preparation of teas, and the rest is from solid food, say. And if we have a higher consumption of fruits and vegetables, we say so the plant-based diet is applied, so we might have some more from solid foods than 1/3 or one quarter. It can be perhaps 40%.
So does that link in any way, or is there any correlation with total water intake amongst those? So if you have more or less of the water in your diet from food, does that relate in any way to your total water intake? Does it tend to be higher or lower?
It is, but the mixed diet is a problem in its definition. So if the WHO population level, the recommendation for the population level is 400 grams fruits and vegetables as a threshold. In Central Europe, we say, so at least this, but preferably should go up to 600. But if you have a mixed diet, as we have it in the northern part of the European Union, in Sweden and Denmark and Norway, they have less than 50%, 40% of 400, and they have a mixed diet. But plant-based mixed diet in the south of Europe contains more fruits and vegetables, and that would contribute to a higher intake of total fluid. It differs. I think that is the reason why I said, so we need information, we need to perhaps to use the same terminology, so under the same intentions of use. Good. Thank you.
Well, I I would like to know a little more about the new program of EFSA that is, I think the program is called MINU, and it's a program for 4 years to measure dietary intakes in the 27 countries. That is a prospective study, and I think it's for 2018. The first results coming in 4 years. Could you update that? Because I think it's going to be finalized, this program of harmonization of the different national surveys. And as you can see, not all the countries give the same accurate and targets, and as we commented also from the physiological and nutritional point of view could be different, you know. And if you have comments about it, because I think it's important for the
it is 2 points in my comment. It is the method used, and this is what EFSA for Europe, for the European Union, is trying to have a generally accepted method. And the other point is to use the proper food composition tables or food database. And EFSA Europe is working on this. They don't have it finished yet, but if we have both, so a method recommended to be used everywhere and the proper food composition table or food database, I think we might reach in 4 or 5 years' time from now a more satisfying level of precision. But I think Europe is working on this, the EU.
Okay, I think that there are some kind of preliminary protocols that is coming from the national food safety agencies that I think is public, I can share, because hydration is a big part of this questionnaire. Maybe it's time to do comments because I think it's starting in 2015. And the second comment is, according to the data that you saw, we can conclude that there is, not for all the targets, but the European population reach around 2 liters of water per month and around 1.5 per human. We are in the range of EFSA is recommending, more or less, yes or no?
I think in the different regions of Europe, we still have national guidelines. The recommendations of EFSA is not applied everywhere. So we have in Central Europe, for the German-speaking countries, Hungary, Slovenia, Czech Republic, and also Serbia. So recommendations we developed for us. And in the north, they have the Nordic countries, their own recommendations. And we hope that EFSA's guidelines will be covering all these regions. But still, we are working with different guidelines. That is, I think it's something would be good if EHI would make welcome recommendations or publish an opinion on this. It can add to the discussions. Yeah. Larry.
In my relentless pursuit of the aging issue, I just looked up the Mann's article again, and I just want to make a couple points because I'm very confused about these data. Well, just go back to the previous slide.
This one?
Yes. If there were truly an age difference in water intake, it would show up in men and women. The fact that it only shows up in men, and the conclusion that Mann's draws from his article is that these differences are all due to differences in sweating rates in the younger subjects. So you have younger men and women being more active. Yeah. They sweat more, and so they have less fluid to excrete in the urine. There clearly is a difference in urine concentrating capacity in the elderly, but they have less fluid to excrete because they've lost less as sweat.
Yeah.
And so again, is this...
non-renal, so is in the elderly also decreased?
Yeah, the non-renal is sweating.
Yeah.
Yeah, so it's much higher in the younger.
Yeah. And
so that only leaves 1,200 to excrete in the urine in the young, but it leaves 1,600 to excrete in the urine in the old. So again, to me, that reflects a behavioral change in terms of activity and sedentary lifestyle, as opposed to something that extraordinarily changes physiologically as we age. There are clearly differences in renal function and thirst, but...
it's a good comment to be discussed and considered in the recommendations, because our recommendations, so we develop, so in the UK or in other countries, we develop them for not physically active people. So we have, in Central Europe, we considered physical activity level of 1.4, and now we increased that so to 1.6. But it is more sedentary lifestyle, so it's very low level of physical activity. And with the recommendations for fluid intake, I think we use the same attitude. Perhaps we should consider this in our discussion. So when we revise the recommendations, so we might include more of the physiological wisdom.